Allahumma salli ala Muhammadin kama tuhibbu wa tarzallahu. Welcome to the Royal Student Council, the bird's eye view to the medical concept. I am here to tell you about the Wilms tumor. Wilms tumor is also called the nephroblastoma. When it comes to word nephroblastoma, remember whenever the word is blastoma, always remember that we are talking about some round immature cells. So blastoma are precisely the tumors of the peds age group, for example hepatoblastoma, for example retinoblastoma, for example neuroblastoma. So Wills tumor is also the tumor of the ped age group, and the age precisely is between 3 to 6 years of age. Above 6 years it is less likely to be Wills tumor. Precisely Wills tumor is a tumor of the renal site, but we have documented in the books that extrarenal sites were also documented, but later it was found to be a nephroblastomatous component arising in the teratoma. Teratoma is the malignant tumor that is arising, and it has three layers through which that tumor arises. So one of the differential of the Wills tumor is teratoma as well. Now teratoma, basically Wills tumor has its presentation as a mass in the flank area and the hematuria, and the mother usually complained of the mass, and mother complains of the hematuria of her child in the PEDS OPD. Now, there are some syndromes that are associated. One is the DD, that is called Danish Drey syndrome. The other is the Wagner syndrome, WAGR syndrome, and other third one that is very important is called BW, that is called Back-Wiedemann syndrome. I'm sorry for this. This is difficult to remember, but Back-Wiedemann syndrome. These are the three syndromes that are associated precisely with the Wilms tumor. Now, Wilms tumor has three components. It has blastomatous component, it has epithelial component, and it has mesenchymal component. Now, you can appreciate the gross feature here. You can appreciate that the gross of the Wilms tumor is showing a nodular appearance, and sometimes it's showing the cystic degeneration as well. Now, in the microscopy, you see in this picture that there are three components. One is the blastoma component, which is the immature component, and that is present in the form of round blue cells with a scanty cytoplasm, and you can appreciate that these cells are basically present in the form of sheets. I have nominated these blastoma component with the yellow color. Now, and apart from that, in this same picture you see the round tubules, and these tubules are basically the epithelial component, and they are remnant or reminiscent of the glomeruli or the tubules of the nephrons, and they are sometimes lined by the mucinous epithelium or squamous epithelium or a transitional epithelium, which is normally the epithelium of the bladder. The third component you can see in this same figure, which I have highlighted with the red color, is the spindle-shaped cells. These are the background spindle-shaped cells or the mesenchymal component that is present in this segment. Now, important thing is sometimes it has an heterologous differentiation. In pathology, when it comes to heterologous differentiation, it means that the tissue that is arising in that tumor is not technically belong to the tissue where the tumor is arising. For example, skeletal muscle, if it is arising in the uterus, normally skeletal muscle is not a part of the uterus, but if it is arising in the tumor of the uterus, we will call it as a heterologous differentiation. The same rule apply over here, that a Wilms tumor, it has heterologous differentiation as well. There are important three genes that we have to remember. One is that Wilms, the first word of the Wilms is the W, and the second word is called T. We collect these two words, and we call the gene called WT1 gene and WT2 gene. WT1 gene is basically present in 11 chromosome Q13, and WT2 gene is present in 11 Q15.5. There is a third gene that is called WTX. These are the three genes you have to remember. When it comes to the prognosis or the metastasis, it can metastasize to the adrenal gland, it can metastasize to the liver, it can metastasize to the other organs as well. But precisely the prognosis of the tumor, we have to look for the size of the tumor, we have to look for the stage of the tumor, whether the tumor has perforated the renal capsule and is involved the extra capsular or extra soft tissue extension. If it has involved the soft tissue, it means means that the tumor is already aggressive. If it has involved the renal sinuses, the tumor is already aggressive. If it has involved the renal vein, the tumor is already at a high stage. If the tumor has involved the peritoneum or the abdominal organs, I will call this tumor as a stage 3 tumor. So more the involvement of the organs other than the kidney, more will be upgradation in terms of its stage, and less will be the prognosis, or poor will be the prognosis of the Wilms tumor. So this is all about the Wilms tumor, a bird's eye view to the Wilms tumor, and you can appreciate the figure which I have just mentioned with the different colors. Thank you very much. God bless you.